Today's video is about bone healing. This video was inspired by the recent news that Chris Weidman will have to undergo another surgery to deal with his previously broken bones. Chris Weidman details this in the video he just put up on his YouTube channel. See the link below. For details on his original injury, see my video about tibia fractures. In this video, we will talk a bit about bone healing, Weidman's original injury, and what can be the cause of his bone not healing. If you are a first-time watcher, I'm Dr. Lucius Pomerantz, a board-certified orthopedic surgeon and a former mixed martial arts fighter, and I hope to bridge the gap between the two worlds. If you like this, please remember to do all of the things like share, subscribe. If you have comments, please let me know below. I went into a lot of detail about bones in my original video. Please check it out if you have a chance. When bones break, there's bleeding and inflammation that immediately starts a healing process. Depending on how the bone is treated will determine if it heals by primary healing or secondary healing. Primary healing is when bone is held very stable and the fracture ends are right next to each other, and the healing bone cells can directly cut across the fracture site. However, this type of healing is not often necessary or possible. Secondary healing is when bone is held relatively stable and the body goes on to create a callus. This is something that you can see on X-ray. Secondary healing is the following process. In the initial days to weeks, the body begins to be able to place cartilage down and create a callus. Blood vessels begin to enter the area. The callus made of cartilage is not seen on X-ray until it gets replaced by hard bone. Depending on the bone location and other factors such as patient health, bone stability, other injuries, etc., the fracture eventually heals. We will say that for many bones, that is about 8 weeks. Then, over a much longer time, years, the bone then remodels. All right, Weidman certainly broke his leg, specifically the tibia and fibula. These are the x-rays that he put up before and after the surgery. These x-rays after the surgery look great. His orthopedic surgeon got the bones lined up really well. You'll note that the smaller of the two bones, the fibula, did not get fixed with orthopedic hardware. This is not always necessary, though you may recall from my recent video about Conor McGregor's fractures at UFC 264, reports were that he had his fibula fixed with a plate and screws, along with the tibia fixation. Now, Chris Weidman's YouTube video includes a great discussion with his orthopedic surgeon. Check it out if you can. They discuss the results of a recent CT scan. CT scans are like super X-rays. They provide three-dimensional views with great detail of the bone. It seems that his tibia is healing well. It is healing by secondary healing, which is the intention of placing a rod down the center of the bone. It provides relative stability. There's a small bone fragment that was part of his original injury, a butterfly fragment, but it is not the major issue at this point. However, the fibula is not clearly healing. They discuss putting a plate on this fracture. Now, why does bone not heal? There are two major criteria to simplify things. One, issues with bone stability, or two, issues with the biology. By stability, I mean that the bone wants to heal, but can't, as it is too unstable to heal. The healing process is not able to happen because there's too much movement, either because the orthopedic surgeon did not create enough stability with the surgery, or the patient is not compliant with letting the bones heal. The other reason is that there is bad biology. This could be that the patient has vitamin D or calcium deficiency or other medical problems that inhibit healing, like smoking. Or, and hopefully this is not the case for Weidman, and I do not think it is, there's an infection that is keeping the bone from healing. Sounds like Chris Weidman will be getting a lot of opinions, as he should, and will likely be proceeding with a revision surgery. This is a setback for sure. Doubts will creep in for Weidman. Questions will be asked if he could have done anything different, or if the surgeon could have done things differently. Sometimes bad things happen. He can still make a comeback, but other issues can certainly come up. Let's wish Chris Weidman the best in his recovery. Let's keep moving.